Okay, so here we are looking at um, how personal trainers help to ease back pain for their clients. My name's Erin from Vintage Fitness, and we have Dave, one of the trainers from Vintage Fitness, that's going to be taking us through this topic. So, welcome. It's great to have you here. Again, Vintage Fitness does personal training for seniors, both virtually and in the Greater Toronto Area. There's a team of 18 of us. We just added one new one, so 19 of us. And we only train seniors. We're very specialized at building strength, stamina, balance, and brain health for seniors. So, with that, I will pass it over to you, Dave, to tell us a bit more about back pain.
Okay, thank you very much, Erin. And so, as she said, today we're looking at how your personal trainer can address your low back pain. And I've now been a trainer for 10 years, and to me, the best subtitle of this is building a foundation for pain-free living, because either we're doing this as a preventative measure or we're doing it after the fact. Either way, we're looking at building a foundation for pain-free living. So who am I? Well, I was a meteorologist for 34 years, got to see huge chunks of Canada during that time. I retired in 2013 and no, sorry, 2011. And I fiddled around, tried to figure out what I was going to do when I grew up. And in 2013, decided to become a personal trainer. And part of this was to help my parents remain living independently at home. They were both hitting their early 80s at that point, and they said, we really want to live at home. I've run various fitness classes for those over 55, in addition to workshops, some of them looking at low back, some of them exercising with arthritis, some dealing with stretching techniques. And in fact, I've just started a class with the City of Richmond Hill on looking after your low back, which just started yesterday. I've worked successfully with many clients referred to me by a chiropractor in Thornhill, and most of those people had low back issues, and we got those people all fixed up. My specialties include low back, core conditioning, posture, functional movement, stretching, foam rolling, and I've also been dealing recently with a client who has stroke, and I've done further education on that as well. So the overview for today, we're going to have a quick look at causes of low back pain, what would happen during the assessment with your personal trainer. Then we'll look at building the foundation for pain-free living. And finally, the last section, some key takeaways from today's presentation. So causes of low back pain, we'll have a quick look at the Canadian experience and impacts of low back pain, and most important, the mechanical issues and biological capacity. Back pain in Canada, this information comes to us from backcarecanada.ca, which is run by the Canadian Spine Society, and it's a group of medical professionals and spinal surgeons. And according to them, about 80% of the population of Canada will experience back pain at some point in their lives. So if today you are experiencing back pain, you are definitely not alone. And medical expenditures with respect to low back pain are estimated between 6 and 12 billion, that's billion with a B, annually in Canada. So there's a lot of people with low back pain, and unfortunately, some of them don't even think to look to their personal trainer for solutions, and we can do an awful lot. More than 90% of back and back-related leg pain is benign. That is not caused by a serious underlying injury or disease. And that again comes from the Canadian Spine Society. So this is really what tells us that when you have low back pain, chances are it's a muscular issue, it's a joint issue, and we can address all of that. So now acute versus chronic pain. So we need to understand the difference here. Acute pain is a recent injury, a strain or a sprain associated with a specific activity. You can say, yeah, I know I was just nudging the fridge a little bit, or I wanted to clean something out from underneath it and I moved it. And, So if it's acute, then that's really something that you should be talking to a medical professional about, or physiotherapist in the allied healthcare field. Chronic pain is simply longer term pain. And it could be from an old injury, it could be something that built up over time, something chances are that you did younger and you've forgotten about. But if it's been around for about 12 weeks or more, it's now considered chronic. And as we've seen, most chronic low back pain is not dealing with a serious underlying disease. And so that's really where the personal trainer comes in very, very handy. Common causes of low back pain. There's many ways of looking at low back pain. And this comes to us from the National Institutes of Health. This is their way of slicing and dicing. So essentially 4 key categories: mechanical problems, structural problems, inflammatory arthritis, and other medical conditions. Mechanical problems, this is where you've had an injury, you've got a disc issue, a bulge, a herniation, spondylolisthesis, that sort of thing, or an injury to the bones. Structural problems could be stenosis, and there's a couple of types. There's stenosis that you could be born with, but there's also functional, I'm thinking of scoliosis, I'm sorry. Yeah, a couple of different types of scoliosis. It could be something you're born with. It could be something that has just happened over time. There's excessive lordosis, excessive kyphosis, and these are dealing with the curvature of the back, and spinal stenosis. Third category, inflammatory arthritis. Fourth category, other medical conditions. So there's a few things in here. But I want you to pay attention to the mechanical problems. This is where huge percent of people actually fit in that category. So mechanical problems cause these injuries to occur. One fairly quickly and one has occurred over time. So when your doctor says you have a disc bulge at L4, L5, that's a diagnosis of something that has happened. And we have to understand that, yes, diagnostics are a tool to tell us what happened, but they don't tell us why. And understanding why can help us lead to a solution and start building that foundation for pain-free living. So in each case, you'll see that a capacity has been exceeded. For the one dealing with the blister that's now burst, that's the skin's capacity to resist friction. So that's an ill-fitting shoe. Or maybe they just did too much too soon. But either way, we need to understand why, and we need to look at what type of capacity has been exceeded. In the tire, again, it's a capacity to deal with friction. This is the car ahead of you on the highway that's going like this, and you can just imagine what the ride is like for the people inside. And pretty soon, the capacity for that tire to hold air is going to be exceeded, and then someone's going to have a pain in their wallet, in addition to maybe a pain in the back. So mechanical problems mean that we have exceeded a biological capacity. So over time, these mechanical problems act and they create an injury. And as we've seen, this accounts for 85 to 90% and even more of chronic low back pain cases. So we realize that our muscles, our ligaments, our tendons, our bones, all of these have a biological capacity and to allow us to lift and move and do activities of daily living and things that we love to do. When you exceed that capacity, an injury occurs. An acute injury can become a chronic condition over time, and usually 12 weeks is about the transition. So now we need to look at some of the things specifically in the back. The primary job of the core muscle is to protect the spine. When that capacity has been exceeded, there's an injury, and quite often you'll feel that as fatigue, a little discomfort, a little inflammation, and then finally you'll get pain. And sometimes our beautiful repair mechanism that happens during sleep repairs some of these things. And then the next day you wake up, you feel pretty good. And then maybe a little late in the morning or early afternoon, you'll start to feel that fatigue, discomfort, inflammation, and pain again. That's the sort of thing we want to stop. We want to build your biological capacity to get around that. So mechanical problems are really the why. This is the why behind the disc bulge. This is the why behind the pain that you're feeling in the back. And typically mechanical problems have three main causes: poor movement patterns or motions. Again, repeated time and time again. Just like that tire, it takes a little while for the time to cause that damage. Poor posture repeated over and over again, lifting a load that's too heavy or lifting incorrectly. So please remember, motions, postures, and loads, those are the big whys. And each of these can lead to muscle ligament strain or tear, can lead to a fracture, abnormal wear and tear of the joints, spondylolisthesis, or even excessive lordosis and kyphosis. And all of these, except for the fracture, your personal trainer can deal with. After the fracture has healed and you've been through physiotherapy, then again, you can come to us and we can help you do the next steps. So of course, there's always additional risk factors. It's not just one thing, but many things acting together. Inactive or sedentary lifestyle, because typically when you're not active, some muscles will become short and tight. Some muscles will atrophy. And this means it might be harder to lift or move things that you did so easily 5 or 10 years ago. And this means it's now easier to exceed your biological capacity. Being overweight, we know contributes to a lot of issues. Job-related risks. So maybe something that you did 10 or 20 years ago left a repetitive strain injury that you thought nothing of, but now you're getting older and you feel the discomfort and pain a little more and you want to do something about it. So if you have weak or tight muscles from sitting or from something that you've done, these are the sorts of things that we look at. And then of course there are some genetic conditions such as scoliosis, and that becomes a risk factor for low back pain. And all of these cause abnormal wear and tear on the joints, and that leads to fatigue, discomfort, and eventually pain. Any questions so far? Okay. So what about age? Everybody always asks me about, oh, what about age, Dave? Is it just normal that I have back pain? No, it isn't. Now, we know that our joints are mechanical systems and they do wear down with age, but they tend to wear down evenly. Part of the problem with low back pain is something hasn't worn down evenly. So yes, back pain does become more common with age, but we also know that 85 to 90% of back pain cases are due to mechanical issues. So if we look at time amplifying the effects of those mechanical issues. And if you happen to have one of the other additional risk factors, then eventually you'll get some unusual wear and tear, or maybe just the muscles supporting the spine have atrophied enough they can't support the spine and protect it. Then you're now in a position where your back is going to start saying, hey, it's time to do something about it. So, we can do preventative maintenance, or we can, come to your trainer with pain, and we'll help you build that foundation for pain-free living. Now, the impacts of low back pain, we know that pain affects us both physically and psychologically, and that can make it a little harder to deal with. Back pain can also inhibit some muscles from working correctly, and I've run into a lot of clients where the butt muscle doesn't work properly, or the muscle at the side of the hip doesn't work properly, or the abdominal muscles themselves don't work properly. Those are the three big ones that typically become inhibited with back pain. And they affect the way we walk, the way we do our activities of living, and can make everything that much harder. And sometimes that unfortunately leads to an increasingly sedentary lifestyle. So the muscles that are weak get weaker, the muscles that are tight get tighter, we start to lose range of motion, and the joints become weaker. And typically that leads to then unusual wear and tear, and inevitably, unfortunately, discomfort and pain.
Dave, I'll just jump in here to say that it's not just, I think that you've explained well here, it's not just one muscle group. So
Mhm.
somebody can't think, oh, it's just like the front part of my core and I really have to, it's a series of muscles. So just be careful. Crunches aren't the answer here, is where I'm going with this comment.
Oh, no, definitely.
So
No, definitely not. And even with the low back pain, if that affects the muscle, the butt muscle, that affects how you walk. And how you walk can actually bring back the back pain. So it now becomes a feedback loop. So all sorts of things can go on, and that's why we've got an assessment to help us look at what are some of the underlying causes. And there we go. What happens during the assessment with your personal trainer? Well, often we'll start off with 4 key questions. What caused the initial onset of pain? And there's a couple of reasons for this. This will help us decide whether it's an acute injury or a chronic injury, and it can also give us some keys to understanding the why behind the pain. Do you have good days and bad days? If you do, then this is the best situation for us, because it means the chances of success are very, very high. Now, I have worked with some people who said, no, I don't have good days or bad days. They're just all bad. And sometimes that person is the type of person who the pain is just so much in their mind, they can't think back more than a couple of days. And I've started to work with them a little bit, knowing that if I can't make a difference to their pain in about 2 or 3 weeks, that I'm going to refer them off to a physiotherapist. But every time, we've been able to make that progress, and then they say, yes, you're right, I do have good days and bad days. And then it's all it really starts to come together for them. We'll ask what type of activities trigger or increase your pain, because these are some of the things that we want to find solutions for. We don't want you to do them. We want you to avoid the pain triggers, allow the area to be sensitized a little bit, and we'll show you some replacement movements that are spine sparing, just to help. And those 2 things can make a big difference just on their own. And we also want to understand what activities do not cause pain, so that sometimes these will help us understand recovery positions for the client, or just help us rule out some of the why narrows the scope for us there. Then we'll do several tests looking for your specific pain triggers. And unfortunately, since discovering these pain triggers can provoke some of the pain, we'll also show you recovery positions for pain relief, and we'll be going through some of those a little bit later. That's why I'm on my mat today, so I can demonstrate some of the stuff that we will do with clients. We'll then, with all of this assessment, have information to help you avoid your pain triggers, and then show you spine sparing movements to allow you to do your activities of daily living. And there are other things that we do within the assessment as well, that we do with everybody. And these also give us clues. We can look at your posture. For this, we're looking at, you know, do you have one shoulder hiked up? Is one hip hiked up? How do you walk? Do you have what sort of curvature in your spine? How well can you turn? How well do the hips move? How well do you squat? Because we squat 1,000,000 times a day. Lateral step down test. And this is looking more at when you're on one leg, do the hips drop down, balance control. All of these things get taken into account when we're building a program, building that foundation for pain-free living. Now, I just wanted to quickly show you a couple of recovery positions. And the first one is the one that I do when I've been in the garden for a few hours. My spine will have been flexed a little bit. You know, you're down there doing the weeding, and you can see my spine is nicely flexed. And the spine doesn't like to be flexed for hours on end, or you know, digging or ripping out sod or stuff like that. So the easiest way is just to lie down on your tummy and just elevate the chin just a little bit. So I've just got one fist here. I'm just lying on my fist. And sometimes the first 20 or 30 seconds are a little uncomfortable because the spine is trying to figure out what it is I really wanted to do, because it's been bent the wrong way for a couple of hours. And then just take some nice, slow, deep breaths. And when I'm doing this in person, I'm going to be looking to see whether your deep breath is in fact a three-dimensional breath, and it goes down deep into the low back. And usually a couple of minutes in this position is enough for most people to relieve their pain. And this is especially for someone who is flexion intolerant or has been doing a lot of movement that puts them into a flex position. Like, let's say you've been driving in your car for 2 or 3 hours. Sometimes that ends up slouching a little bit, and the back doesn't like that either. So this is a very, very basic. You can go up on a second fist if you want. If it's more comfortable, you can actually go up on your forearms. But all you're doing is creating a very gentle extension of the back, and that is sometimes enough to give you relief, especially if you're a flexion intolerant person. Now, some people aren't. They've got other issues going on. So there's other things that we can do, putting them up against the wall and getting them to, first of all, flex the spine and then extend the spine. So you see I'm flexing it forward. This would be a slouch if I were sitting, and arching the back or extending the back. Somewhere between those two extremes is your sweet spot. That's the pain-free position. And that's the position that we want to help you create stability for your core, because that's the pain-free position for you. So there's other recovery positions, but those are two very, very common ones, and they will look after over 90% of cases. So the main thing is to find, for that last one, to find that sweet spot where there's no pain And that's the position that we're going to work really hard to help your body maintain that position through activities of daily living. Okay, and now let's have a quick look at how your personal trainer will build that foundation for pain-free living. First of all, some key messages for you, our clients. First of all, as we saw at the very beginning, you are not alone. There's a lot of people with low back pain and a lot of expenditures, a lot of pain, but please recognize that there are solutions out there. Most low back pain is due to mechanical issues, as we've seen, postures, motions, and loads. So somewhere biological capacity has been exceeded, but more importantly, it can be rebuilt. And that's where we work very, very well. And unfortunately, inactivity can make it worse, but back pain, we tend to retreat and we sit more, and sitting is actually one of the worst things that you can do. We'll help you build your foundation for pain-free movement by showing you how to avoid your pain triggers, teaching you spine-sparing movements, and we're going to go over some of these. And then we would rebuild the biological capacity to help you do the activities of daily living and the activities that you love doing. So first, avoiding pain triggers. And you'll already know some of them. And we will have talked to you about that during part of the assessment process. And based on that, trainers will show you other triggers. For someone who is flexion intolerant, doing crunches is absolutely a no-no. Now, some people will say, oh, but I've got to improve my core. But the abdominals are a small part of your core. We have to look at the entire core. And I will show you a variation on the crunch a little bit later that is safe for everyone to do, including those with osteoporosis. Leg raises.
Dave, just quick question. Not everyone may not know what you're talking about when you say flexion. So maybe just show that. And then unless you get into it later, talk about a couple of everyday activities we do that were in flexion. Because if we can avoid the everyday flexion, if we're flexion intolerant, then I think that's half the battle.
Okay. All right. Great. Let me get a little dowel here. That's a great question. Okay. All right. I don't know if I can get far enough away. Now, I usually put a dowel on somebody's back. The head should be touching, the shoulders should be touching, the butt should be touching, and there should be a little room in here for my hand to go between the dowel rod. I don't know if you can see that. Between the dowel rod and my back, there should be room for my hand. Now, this is normal spinal curvature. When I flex the spine, it's going to pull away from my back. So think slouching, and you see I no longer have those points of contact. Now, if I do it as a hip hinge, see, I can bend from the hips and I can maintain a neutral spine. I'm getting ahead of myself here. But anyways, that's a little bit about spinal flexion. So be aware of it when you're sitting down. If you're slouching, you've now lost the normal lumbar curvature, and it's now the opposite direction. Normally it should be like a little cave here. It's not a cave anymore. Okay, so that's what we mean by lumbar flexion. So when you do crunches, you're doing flexion. When you're sitting in a slouch position, you're often in flexion. When you're driving without proper lumbar support, you're often in flexion. So most people I find, most low back pain clients that I've had are flexion intolerant. So that just means that when they go into flexion, they are using up biological capacity and eventually it runs out and they get discomfort and they get pain. So toe touches, knee to chest stretch. These are all sorts of things that can cause the curvature of the spine to reverse. And when that happens and you don't have the musculature to protect the spine, then that can be a pain trigger. There are many others as well, and we'll look at each person's specific situation. Now, here's one you probably weren't aware of. When I ask people, do they stretch? Oh, yeah. As soon as I wake up, I touch my toes. One of the worst things you can do. You may not know, but well, I know because I'm 5'2", so it's very important for me to feel a little taller when I get out of bed. And indeed, you do feel a little taller, and you are a little taller, and that's because the discs that are between the vertebrae, you've got 24 of them, and those discs have actually enlarged a little bit overnight because the body's done its repair and maintenance. And so those discs are now all nourished, and you've been on your bed all night, so there hasn't been crushing gravity on them all day. And so they are a little bit enlarged. So please, please, please don't do full bending and twisting within 45 minutes or an hour of waking up, because the spine is naturally stiffer then, because those discs are now slightly enlarged. Once your feet hit the floor, gravity starts to take over, and you shrink back down, you lose that extra quarter inch. Very important to people like me, but you lose that quarter inch fairly quickly. Then you can do your full bending and twisting. So when you learn to avoid the pain triggers, and that's the whole point, this is the first step here in building a foundation for pain-free living, you allow the affected area to desensitize or calm down. And then we can start building biological capacity. So we also will be showing you some spine-sparing movements. And the first one be just a brace. I've had a client, I handed them a 2-pound weight and asked them to hold it out like this. That brought on pain. So this is someone who is compression intolerant, and we had to do a lot of rebuilding their core, but I also had to teach them how to brace. So bracing is very, very simple. You can put your hands just below the rib cage here, say, ha, ha, and you feel the muscles pushing out. That is your brace. Now, it should be something that the body does normally, but people who have had low back pain, sometimes the body forgets how to brace. We have to reteach it before we rebuild that biological capacity. There are other ways of teaching the brace, so if that one didn't work for you, we've got a bunch of others. Another important movement is the hip hinge, which I started to show a little bit earlier, and that allows you to bend and maintain a neutral spine. So here I've got my handy dowel. I've got points of contact with the head, the shoulders, the butt, and yes, there's room for my hand here. And if I hinge at the hip, so you notice I'm not hinging. If I hinge at the spine goes round. If I hip hinge, then I can keep a neutral spine. So now I can bend down to pick things up. We can also squat. A squat's another great way of getting down, but you have to be able to maintain a neutral spine as you do that. So there may be some range of motion issues in the hip or the ankle that we have to address so that you can get down nice and low and maintain a neutral spine. So you can lift up the grandchild, and guess what? It's now going to be the legs and the butt that are doing the lift instead of your back. Lifting with your back. Back's not designed to lift. Standing strategies. Oh, wow. Yeah, went through some of those yesterday. Very, very important. A lot of people, when they're on their phone, the shoulders are going to be a little forward, the head is going to be a little forward. So here's something you can try right now. If you take a couple of fingers just either side of the spine, there's a great big pile of muscles running up beside the spine. on the left side, the right side. So just hold on to, put your fingers on those muscles and lean forward like you're reading your phone. And you'll find that these are very, very tight. As you come up into a neutral standing position, they become nice and relaxed. So what we really want is for the muscles at the front of the body and the muscles at the back of the body to be in balance, and then both are firing minimally. But if you're leaning forward, these muscles are now working extra hard. And after a few minutes, they'll say, hey, we don't want to do this anymore. And they'll send you a little signal of discomfort, and eventually they may send you a signal of pain. Another great strategy for standing, just take your hands, put them in behind. Sometimes, and that's, guess what? That's going to take the shoulders now that had been forward and bring them back. When you're standing, a lot of people will stand with the hips behind the shoulders. So, sorry for the image here. But if you put a toonie between the butt cheek and squeeze that toonie in place, see the hips come forward, and now I've got better standing posture. I've shown clients how to stagger. So one foot is slightly in front of the other, and this distributes the weight a little better, and they're able to stand for longer periods of time without causing pain. In the kitchen, I open up the kitchen cupboard and I'll put my foot in. So this raises one foot, and again, it extends the neutral position and makes it a lot easier. Opening doors. Oh my goodness, I've seen people open doors like this. I'm now opening with my back. So what we really need to do is to reach across and pull, and this becomes a twisting movement. And yeah, we've got lots of exercise to reinforce that movement pattern. Walking strategies. If someone is walking like this, they're not taking advantage of the natural springiness that we can have in our bodies. The head is down, and that's pulling the shoulders forward, which is now making the back muscles work extra hard. So if when you walk, naturally, the upper body is going to turn one way, the lower body is going to turn the other, and it's going to go back and forth. And it's, you know, it's really great. And if you can walk in the woods, that's even better. So walk a little bit faster for a couple minutes, heads up, full arm swing, and that's going to help an awful lot. So some of these are beautiful spine sparing movements, and we work really hard with our clients on these. So we're going to be building biological capacity, and a lot of people think, oh, my core is my abdominals, my six pack. Well, no, you have to build core stability in all three dimensions. The body moves in all three dimensions. We have to build that core capacity, that core stability in all three dimensions. We need to activate inhibited muscles, and we will see during the assessment which muscles have become inhibited, and we can work to bring those ones back to life and teach them to do what they're supposed to do. We would be doing exercises to address postural issues. We'll be looking at the short, tight muscles, and we'll be strengthening the weak muscles. And we'll be looking at functional movement patterns. So helping you learn how to squat and walk and push and pull and hinge, all of those important activities of daily living. They all go into building biological capacity. So building core stability, just a sec here, sorry. I should have taken my sip before I went to the slide. Anyways, there's 3 key exercises that we will do here, and I will demonstrate each one of them. And each one of these we're going to do in your neutral spine position. This is your sweet spot. This is your pain-free position. It's a progressive approach. So we start with low volume of exercises, low intensity, and we build up. And the focus is on good form and pain-free movement for all of the exercises that we do, not just the ones that I'm about to show you. Your personal trainer can accommodate all ability levels. I'm going to show the ones on the mat here, but we can do these standing, we can do these leaning, we can do these many, many different ways. So the first one is the bird dog. And this is a lovely exercise. So one arm and the opposite leg go out, and we will be teaching the body a little bit of stability, going diagonally across the body. As I say, there are many variations on this to accommodate all ability levels. The curl up. This is the one curl up that you can do. And on this one, the hands will be below the low back. One knee is bent, one leg is straight. This prevents the pelvis from rotating and causing back pain. And all you're going to do is lift the head and shoulders up. This is it. The abdominals are now contracted as much as they need to contract in order to build that muscle. Okay, so that's the one crunch that you can do. The last one that I'm going to show you right now is a side bridge. And again, there's many, many variations on this, but this is all it is. And this is now building stability on the lateral side of the body. So altogether now we have to build not only the front part, we have to build the sides, we have to build the back, we have to build along the diagonals. So these are all exercises that we can get people to do. And walking. Oh man, walking is so very important. It gives your back a little bit of massage. Every step you engage the core and you unload the spine when you do it properly. So with the full arm swing, you've got the upper body going one way, lower body going the other, and it unloads the spine, engages the core. It's a marvelous exercise and highly underrated. Focus on good posture, full arm swing, head up. And if walking causes pain, your personal trainer can show you how to use something called a decompression. And you can do that on park benches, you can do it on your desk at home. And it decompresses the spine. So someone with stenosis especially, that would be very important for you. You know, start with a 10-minute walk and then build up to 30 minutes. You could even do 3 10-minute walks, one after each meal or whenever you have time during the day. But walking is so important to working with anybody who has had or is suffering from low back pain. So let's look at some of our key takeaways for today. First, it is common to have low back pain issues. You are not alone. Most low back pain, as we've seen, is due to mechanical issues, which is really postures, motions, and loads. And our assessment will tell us which ones are problematic, and we can help you rebuild that capacity. So biological capacity has been exceeded and it can be rebuilt. And unfortunately, inactivity can make the pain worse. So we have to get you moving. We will identify your pain triggers and show you how to avoid them. And then we'll build a foundation for pain-free living, showing you, starting off with avoiding the pain triggers, showing you spine-sparing movements, recovery positions. I showed you 2 today, and rebuilding biological capacity, which includes building the core stability that we need, looking at muscles that have been short and tight and other muscles that are weak. Maybe some muscles have become totally inactive or inhibited. We have to look at all of those. And that's how we would then build your program. Anyways, thank you very much for your time today. I hope you appreciate that there are lots of things that we can do to build a foundation for pain-free living. Questions?
Well, thank you again, Dave, so much. It's such a fount of information, and just the reiterating that you're not destined to have back pain. your whole life. Some people, I feel like, oh, they live with it. It becomes part of their identity, but that doesn't have to be the case. So there's a question, what's the advantage of Dave's stability ball over a standard chair?
Well, I'm in my workout area, so I'm sitting on my ball so that you can see me. It's mainly for height. Some people do prefer sitting on balls, and that's fine too. Just make sure it stays inflated. The main thing when you are sitting is to change positions. And you notice I'm changing positions. I'm moving around the ball. When I do personal training and I happen to have a ball handy, I sometimes just sit down, and it's great. I can actually, here's a nice little massage for the low back I can do. But for this presentation, no, it was convenient so that you'd be able to see me for most of the presentation.
Amazing. Any other questions for Dave this morning? Well, that was amazing. Thank you so much, Dave. And I will send this recording out to you so you can review it or send it along. So I hope everyone has